go bad because I leave real early for that, so I usually miss the traffic.
The Committee on Regulatory Reform will now come to order. Madam Clerk, will you please call the roll?
Chair Carter,
Present.
Representatives Liberati,
Present.
Neely,
Here.
Scott, Young,
Here.
Grant,
Present.
McFall,
Here.
Snyder,
Here.
Wilson,
Here.
Mueller, Filler,
Yes.
Wenzel,
Here.
Aragona, Beerline, Nair.
Here.
Mr. Chair, you have 11 members, you have a quorum.
Thank you. Rep. Neely moves to adopt the minutes from the February 28th, 2023 meeting. Seeing no objections, the minutes are adopted. Next, it's been a long drive up here today for many of us. Next, we will welcome Paige Fultz from the Department of Licensing and Regulatory Affairs to provide an overview of the department. Good morning and welcome, Paige.
Good morning. I'm impressed you got my last name. Thank you guys so much for having us here today. Very excited to give you an overview of Lara. Just wanted to take a few minutes for those who have not had a chance to meet our team yet. They're right behind me here. We have Marnie Treemstra, and then we have Mac Jones and Neil D'Souza. So that would be your team if you have any questions. And I know that CRA is coming up after us, but Derek also works on legislative issues behind as well. They're the teamwork that keeps us flowing. So the big piece is Lara really is the main organization that oversees professional licensing, construction, and commerce. They were reorganized in 2001, and that is when the name Lara was given. There's about 2 million individuals and entities that Lara serves currently, and they regulate under both state and federal law. So here's our vision and mission, which you could, I know, get for yourself online. But one reason I wanted to put it up here is I changed some of the words to orange that I really wanted to flag because it is the heart of what Lara does. This legislative session, our goal is to work with you guys toward these strategic goals we have that reduce barriers to licensure, remove regulatory compliance through education and consultation, provide efficient, effective, and timely services, and enhance the customer experience across all of the programs that we house. Our mission and vision really do flow. Sorry, this is directly from our core values. These really are the foundation of both work we do internally and externally. So the biggest pieces that I wanted to talk about were the five you can see here. Public service, present and provide guidance to all citizens. Transparency, we focus on being open, intentional, and try to be explicit in what we do and what we're communicating with to the public. We want to make sure we're accessible. Allowing the open contact and equal opportunity to be able to reach out to Lara. Our workforce, we're individuals both engaged within the department and then the individuals that we service that are part of the workforce on the outside. And then responsibility really is our obligation to hold up the accountability and the actions that we have within the department. When you put it all together, it really focuses on Lara's two main concepts that you can see in our logo, which is protecting people and promoting business. We really do strive to create a licensing and regulatory environment that focuses on business growth and job creation while safeguarding Michigan citizens at the same time. Laura is big. There's a total of 19 agencies within Laura, and you can see they're divided into a few categories. We have a regulatory bureau, our independent agencies, who you will hear from one of them today, and then central services, which is where your favorite people sitting in that row are located, and myself. So please feel free to reach out to us at any time with legislative questions or issues or constituent issues that you guys are facing. I'm going to start really with the regulatory bureaus. So these bureaus, Laura is their principal department. And the first one is our child care licensing. This focuses on protection of children, ensuring that anyone in a licensed healthcare setting is safe. They also investigate state license issues. They do routine inspections, again, to ensure the safety of the children. And then most recently, there has been the push for individuals to start their own daycare businesses with entrepreneurs with our Strong Start. And they have individuals that are working to expand their childcare business or provide grants for those who are starting. Then we have the Bureau of Construction Codes. Really, any environment that is built or constructed and the systems within them. The idea for BCC is to make sure that they are safe and that they are sound and sanitary. We have the skilled trade licensing under this area as well. This is our elevator safety, plumbing, boiler, for examples. We also have kind of a combination. Ski, amusement are under here as well, and remonumentation. There has been, this has been highlighted, especially since last session, since the border between only Michigan and Indiana really is not clearly defined, where the rest of Michigan's borders are defined. We had either the, Toledo War where it was settled. There were different pieces, or where Michigan and Wisconsin sued each other and it went to the Supreme Court. So Indiana, our Hoosiers have been friendly in that, so we're trying to figure out the actual border of where it would be. Last is our corporation, securities, and commercial licensing. Last on this slide, don't get too excited, I did say 19. So this is really the corporations and LLCs with it. It regulates the security industry and other various professions kind of along those lines. So you have funeral directors and security guards, personal investigators. Really, that would be the type of individuals who would have the licensing under that. Bureau of Fire Services. Our director of the Bureau of Fire Services is also the statewide fire marshal, and they really focus on any issue related to fire safety in our state. The fire safety code adoption, they review and inspect different facilities to make sure that they are up to code. They also focus on training firefighters to make sure that the approved standards are being followed and implemented in regards to safety. Bureau of Professional Licensing. This really is a large piece of the regulation where it talks about individual Michigan licenses. So over 750,000 individuals have licenses under here. This is the occupational code as well. We have cosmetologists, real estate brokers, those individuals. And they maintain the state's prescription monitoring system, or MAPS, which is related to controlled substance use across the state there. They also investigate and authorize complaints against the individuals who are licensed in this particular bureau. And the licensing boards determine the sanctions and the disciplinary actions that happen against the individual licensees. So this is the last slide related to this particular piece of bureaus. We have the Community and Health Systems, more formally known for us as BCHS, I guess less formally. We like to do the alphabet soup quite a bit here. So this particular bureau is designed to protect the welfare of individuals and services that they received through covered providers. There's more than 20 types that are under this particular bureau. An example of these really is like nurse aid training programs, adult foster care, healthcare facilities. And I'd like to flag too, in your packet that you guys received from us, the handout, we do have a list of them and the regulation broken down on the very last page. So I'm not going to give you a pop quiz on it after, but feel free to use that as well. These bills typically do go through health policy, so that is one. Occasionally they'll be coming through this committee, but just wanted to flag that that's kind of where they mainly end up lying. We have a brand new bureau as well, survey and certification. This was established in 2022, and really it was to provide oversight of the federal survey and certification process. And again, these are for over 20 healthcare providers. So there was a lot of confusion between the state and federal levels, and this made the line and boundary just significantly more clear. Now I'm going to move on to what we call our Type 1 agencies. Really, these are a little bit different than bureaus, and I just want to, kind of flag that the differences that are created between them. So these services are administered and supervised under LARA, but there are statutory powers that are completely independent of LARA. So like budgeting, procurement and management functions really are under the principal department of LARA, but the other pieces are really up to the Type 1 agency for that. So we do have the first one, we have MIDC, and this is related to minimum standards. It's talking about a constitutional right for counsel, and this is something that was a piece that is being rolled out in multiple phases. There's more than 130 local delivery systems that support coming into compliance with these standards. MIDC gives out grants to the local systems to ensure that everyone has effective assistance for legal counsel. MLCC, this is related to alcoholic beverages and the consumption. The idea behind that is to protect health and public safety related to alcohol, but then also regulate the sale and the distribution of it to make sure it is. MLCC also does do what we call special licenses for events, such as if your district is having a fair and has a beer tent, or you have a local church that will be having a beer tent or something along those lines where you need a pass for 24 hours to be able to serve alcohol. Special licenses are granted through that. So we also have our Cannabis Regulatory Agency. So this really is a program that is inclusive of the Patient and Caregiver Registry, medical marijuana and adult use marijuana, and licensing and hemp processing. So I know Director Hanna will be covering that more extensively. We have the rule-making section for all departments, also known as the Michigan Office of Administrative Hearings and Rules. So the administrative rulemaking process for every department does sit within LARA. It is also a centralized hearing system where several divisions can come together to make appeals for, Michigan tax laws and things, known as also the Michigan Tax Tribunal. Overall, I wanted to mention, because it comes up quite a bit, about remote access related to COVID. One very, successful forced pilot program, Moore was really thriving and able to thrive in the remote platform when in-person services had to be shut down. The office held over 9,500 more hearings and closed more than 16,000 cases than it had the previous year. That had to do with individuals being able to log onto their computer instead of driving up to Lansing to show up in person. Just wanted to share that piece. The Public Service Commission. This really is focused on energy, providing safe energy and accessible energy at reasonable rates. And they regulate quality of service and infrastructure proposals. The Michigan Public Service Commission actually is doing a presentation with MLCC, and we right now too at 10:30 in APROPS. If anyone has questions, we'd be able to connect you to them after, or we'd be happy to answer them. Unarmed combat. This is the last one of our Type 1 agencies here. It is focused on eligibility and licensing for unarmed combat. When we talk about unarmed combat, it really is focused on mixed martial arts and boxing. And central services. These support LARA as a whole. And that is really why we are here. We monitored about 500 bills last time. As I mentioned earlier in the presentation, we would love to work with you if you have ideas related to legislation, any constituent requests, anything related to individual bureaus. We are always open in here to chat. So please definitely reach out. And one of the reasons I had mentioned appropriations too is our FAS department, or our Finance and Administrative Services, works on the budget with us. They develop and monitor the state's annual budget and ensure that our legislative reporting requirements that are related to the budget are met. So that would be our counterpart there in regards to our budgeting process. And with that, I hope you enjoyed the very exciting world of licensing.
You skipped 3 pages, but again, there won't be a test, so I can understand that. Well, thank you so much. I've got a few questions, and we'll see if anybody else has any. So, to my understanding, there have been discussions in the various LARA DIF appropriations committees about various licensing fees with upcoming sunsets. How many of those sunset dates are approaching this year? Are there any that you're most concerned about expiring?
So I'd say we're concerned about all of them expiring. The negative impact for us would be $20.3 million. So it's a massive piece. It is 39 licenses over 7 different acts. So that is something we are strongly working towards, since it would negatively impact the services we can provide.
Okay. Next, can you explain the due process rights excuse me, individuals have if they're denied a license application or if their license is revoked? What rights do they have to appeal?
So there is an appeals process, and I'm happy to give that information to you step by step after the committee. So it varies depending on which type of license you're talking about and which bureau. So it's not a clean uniform of one one process for all in that way. But we can break it down by bureau if you'd like and follow up with that.
Okay. How do you investigate unlicensed? When I look and see professional licensing, I'm not going to say I know any, but I'm sure people know that folks are unlicensed to do hair, eyebrows. I see them at the mall. Do complaints come to you anonymously, or does something have to happen? Usually something happens and somebody tells. So how do you track those things?
So you can file complaints online, and that would be, one way it could start. It doesn't necessarily have to be that there was an incident that happened. An individual could see someone that they are concerned is unlicensed, as you mentioned, at a mall, and then submit that information, and then an investigation would start. OPLA doesn't do the investigations, personally. Whichever bureau the complaint would be in is where that would go.
And just for anybody watching, when you go into a place, look, they should have their license displayed. Is that correct?
Yes, they do
Okay.
typically have their license displayed.
Okay. And finally, for me, what are some of the major projects or topics that the department plans to prioritize during this session?
Oh, well, we have quite a few. There's one in particular we're looking toward, which is related to remote meetings. Lara houses in our BCC the barrier-free design board. Those individuals have been having a hard time being able to reach quorum because they no longer can meet remotely, which is something that was granted during COVID. So that's one piece we're going to be working toward that we had also worked toward last session. There are a couple other pieces, closing loopholes related to pharmacy background checks. That's another piece that we're exploring as well. As laws, are being made and changed constantly, we just want to make sure no loopholes exist for background checks, especially related to controlled substances. So those are some of the main pieces we're going to come out of the gate with.
That's great, and that was impressive about the number of cases closed because of the remote access. So that was huge. Hopefully we can continue that. So with that, see a couple hands. Representative Young.
Thank you, Mr. Chair. Thank you for being here this morning.
Thanks for having us.
So I know that you touched on the Indigent Defense Commission. I want you to go a little bit deeper into that. I want to understand a little bit more about how people tap into that if they need this type of defense, and how I understand there has been an increase in the budget. Do you know about that, an increase in the budget for this and what that's covering? Because I've gotten some calls about that, particularly from my Wayne County prosecutor, up in arms about they're getting all the love and we need some help too. And so I said, let me just go ahead and ask you get some additional information. Thank you.
Yes, so first of all, we have a great kind of one-pager that the director over there has made, and I will send your way. The way the statute works and is worded, unless there are funds committed to an individual phase that is being rolled out, it will not be rolled out, which is why there are phases being rolled out for MIDC along those lines. But the big piece is trying to make sure everyone has, access to fair counsel, and certain phases include different pieces, ensuring that the caseload doesn't get to be too high, that you have legal representation at your very first time you're appearing before a judge, so you're not up there alone. That was an individual, phase as well. So the services range for that, and so there still are two more left that would be rolled out. But yes, anyone who has a need for legal counsel would have access to MIDC.
Quick follow-up. So based on your staffing levels, is it fair to say that if you don't have a person who's able to defend somebody, that they just have to wait until someone becomes available?
Well, we do in the budget have a request to increase for MIDC, so we would appreciate support for that. Depending on the area you're from, I do know that, Wayne County versus Iron Mountain, obviously the case levels vary significantly. But the plan is to, provide everyone with efficient defense as quickly as possible. So we are hoping that with some of the increase, we'll be able to provide even more services. Also, if you have an individual you need help connecting with, please shoot me a note. So.
Thank you. Representative Scott.
Hello, thank you so much for your presentation this morning. So what type of resources and oversight does the department provide to its regulatory bureaus?
Do you mean trainings, the trainings and education?
Right.
That would be some of the biggest pieces. We make sure that training is offered, and that there's an easy way to submit your training back. Overall, the actual rule-making process is what determines quite a bit of the continuing education credits for each department, and those are open to the public. There are work groups before they go into rules are released, and then obviously the public hearing, which is always after, but we take public stakeholder feedback during that time and make sure it's incorporated.
Thank you.
Thanks.
Representative Aragona.
Thank you, Mr. Chair. And thank you very much for being here. I just wanted to circle back around to the conversation you were having. Which licenses are set to expire soon? I think you talked about a couple of licenses as well as how much less that would be to the department, but I'm sorry, I'm a freshman, so I wasn't here for last year's discussion. So
There's actually a pretty big list that I can send your way.
yeah, that'd be great, actually. if you
So,
just wanted to do it
okay,
that way.
but yeah, it's a total of 39 licenses
39.
over 7 acts. And it really is sunsets. If the sunsets aren't adjusted or eliminated, which would be our preference, then some of the fees will resort all the way back to 2003. So it would be, that's when I mentioned the, massive impact. It'd be rolling back fees over 20 years.
Okay, gotcha. All right, yeah, if you could send that to my office, that'd be great. Slide 5, you have under regulatory bureaus the construction codes. And forgive me, I'm kind of coming from a municipal knowledge base. And I know, if I had a question, I went and talked to my building director, right? He was responsible for knowing the building code. How deep is a cement slab supposed to be, where the setbacks are. Is that something that he's getting from you guys, or are you is this regulatory just licenses for builders? Is that what that means here?
So, again, related back to the rulemaking process, what happens typically is ideas and standards are released on a national level by the experts in the field, and then Lara takes them in. Again, we hold public hearings and work groups to make those adjustments, and then the draft rules are released, and it's the same with the code. The draft codes are released. So it is up to the state of Michigan to decide what pieces related to the national level are going to be kept in the code, and stakeholder feedback is a large part of that.
Okay, but you said it starts at a national level?
Yes, so typically they're depending on what it is. It would start at a national level. They would release what they would consider ideal standards, and then we would be going based off of those.
This is an association, or is this the federal government?
Typically, it's no, it's not the federal government. It is more of an association that has expert in the field that is related to codes.
Okay, all right, thank you. Slide 7. I notice you have the Bureau of Fire Services. I know I was actually hiring a couple of firefighters a couple of months ago, and I noticed that there's a new license, I believe it's Firefighter 3. Used to just be Firefighter 1 and 2. Can you speak to why we have an additional license now?
I cannot. Sorry, I'll have to poke our state fire marshal, Kevin, and get some more information about that.
Okay. All right, I appreciate that. Thank you. And then this might actually be a question for the next presenter, but I know that you guys oversee cannabis. Seed to sale, correct?
Yes, I'll let Director Hannah take those.
Okay. All right. You know what? I can save those questions for him, so thank you.
All set? I have one more for you, just one real quick one. So, Laura often provides input on pending legislation with concerns, whether it supports or doesn't. Typically, how is that evaluated when you look at pending legislation?
It comes through our office. We take a look at it, and then we reach out to the bureau that it would impact the most and ask for their feedback related to it. And then we would be able to reach back out to your office and provide those comments. So out of our 19 bureaus, sometimes it affects only one, sometimes it affects more than one. And so that's how we get our feedback, our initial feedback.
Okay. Thank you. And thank you so much for being here today, and we're looking forward to working with you.
Thank you so much.
Thank you, Ms. Fultz. All right. Next up, we have a presentation by Director Brian Hanna and Derek Sova with the Cannabis Regulatory Agency. Welcome, gentlemen, and thank you for being here today.
We're checking to see if their PowerPoint's on the computer. Might not be on yet.
We'll go at ease for a second. Call its chair. For the sake of time, I think all of us, we're back in session. For the sake of time, I think we all have it, and it's usually a great idea to have it to follow along. So you talk about it, we'll go ahead. Because I'm sure, I smell that there's going to be questions.
Well, good morning, Chairman Carter and members of the committee. Good morning. My name is Brian Hanna, Executive Director of the Cannabis Regulatory Agency. Thank you so much for having us here. I have with me Mr. Derek Silva, who is our Policy and Legislative Specialist with CRA. So we'll get started and we'll go old school with our paper slides. Okay, so at the CRA, we are responsible for regulating 4 statutes. The first one that really got it started was the MMMA, the Initiated Law of 2008. That is established the Patient and Caregiver Registry Card Program that we manage at the CRA. And then in 2016, we have the Medical Marijuana Facilities Licensing Act, and that established the commercial market for the medical marijuana businesses in the state of Michigan. And then shortly thereafter, the Initiated Law 2018, which is affectionately referred to as MRTMA, which is the Adult Use Act, established the commercial adult use market for cannabis in the state of Michigan for marijuana. And then we also have portions of the Industrial Hemp Research and Development Act. Particularly, we license hemp processors and retailers, or a hemp processor handler license, excuse me. And so for the next slide, we have the registered patients and caregiver statistical information. The top blue line, if it's blue on your papers, it's blue on mine. The top line is the one representing the patient statistics. And so if you can see in the beginning of fiscal year 17 and 18, when we started to have the initiation of the Medical Marijuana Facilities Licensing Act and regulation, you notice that there's steady buildup of patient numbers. And then after the implementation of adult use in 2019, you're starting to see a decrease in patient numbers in the state of Michigan. Right now, with adjusted information that we just received this morning, there are 170,537 registered patients, medical patients in the state of Michigan right now. And then also with the caregivers, you can notice there's somewhat of a steady plateau after the implementation of adult use in 2019. Those numbers right now are at 17,643. So again, some of those numbers increased right in the beginning of medical marijuana businesses implementation and started to plateau or decrease after the implementation of adult use. But from what we're seeing, we still see that there are going to be a patient and caregiver program need in the future. We believe that people need access to their medicine. We still see an active and healthy number of caregivers. We still think that's a program that's going to continue forward. Okay, and then the next slide for commercial marijuana licensing. These are statistical data information as of January 31st of this year. We have some updated numbers for these as well. Right now, we have 3,167 active licenses in the state of Michigan. Now, these are active business licenses that are authorized to sell medical and adult use marijuana in the state of Michigan. A lot of these licenses could be, outstanding. A lot of these licenses could be in one location. For example, people have the ability to have stacked C grow licenses in one location. So there's a possibility that there could be up to 10, 15 licenses in one location. But again, these are the number of licenses that are in the state of Michigan. We issued our very first medical marijuana business license. Oh, thank you so much. We issued our very first medical marijuana business license in 2018. And then shortly thereafter, we issued our first adult use business license in 2019. In the beginning, it was an influx of medical businesses, and we have retail sale information that's coming up in the next few slides. And then also with the adult use market taking off rapidly in quick succession. So us as an agency getting ready and implementing the medical marijuana business facilities licensing and then adult use right on top of each other, moving forward as one joint industry. What's key in this information on the statistical information is highlight here is lawmakers will, if you have not already, be approached of a possible talks of a moratorium, and we'll get into more of those discussions in further slides. But if you notice in the statistical information we have on the adult use side and the medical side, we have more grow licenses than we do retail. And that's part of the condition of the influx of product right now, where prices, which is coming up in the next few slides, have dipped dramatically in the recent months in a couple years. But with this information, there's also things that we'll talk about in the future of this presentation of illicit activity that's happening in the regulated market. Those two combined leading to talks of possible moratorium that people may be interested in the industry, that I know that people have different flavors or different varieties of moratorium. I would say the number one idea of moratorium that we've been hearing is a possibility of asking legislature to amend MRTMA to allow a moratorium of suspending grow license issuances at the state level with needed social equity carve-outs at the state level. And the reason is at the state level, if somebody qualifies at the state level for a license, we're obligated by the acts to issue that license. Like other states that have the influx of cannabis right now, for example, Oregon, other states like that, they do not have the ability of capping licenses at the state level unless a moratorium and change in acts occur at the state level. It's just situational awareness that those are some of the talks that are coming, and we'll get into the specifics of why in some of these slides here next. Okay, so retail sales, this goes along with the implementation. The blue line is the lower line and the higher line is the orange line. The blue line represents medical retail sales, the medical businesses, and the orange line represents the adult use retail sales. Again, these are sales that are happening at the retail level. If you have note, the medical side had kind of a peak or a plateau, if you will, around the 2020 time period, right when adult use started to take off. And right in the May 2020 time period, adult use sales became predominant in the industry for cannabis in the state of Michigan. Of other highlights for this information is for the first time in December of 2022, adult use sales have reached over the $200 million month mark in a 1 month period. That's of note there. Also, as you can see, the medical marijuana sales have continued to slide down. We do believe, though, if you look at the data, we think in the next few months, we think medical marijuana business sales may rise because of a change that we just implemented on February 8th. So we received feedback in talking to stakeholders that businesses previously had to ask the CRA permission to be able to move their product from the medical side to adult use side and vice versa. And we felt that it was important for patient access to be able to do that. The businesses could do that on their own without asking permission to CRA to do that. What that ended up doing is that freed up 2 of our staff, full-time employees, to do other activities pertaining viewing statistical information, looking for illicit possible cannabis in the regulated market, but it also gave the opportunity for businesses that had to wait up to 72 hours before to move a product for patient access right at the counter. And now medical marijuana patients can ask for a product that's on the adult use side, and it can be quickly moved over by the business quickly without asking us for permission. So we believe that retail sales for the medical side may see an uptick. We'll continue to evaluate those sales. Okay, retail prices. So this is a graphical depiction of what we talked about earlier, the possible talks of moratorium that you may hear. And the CRA stands ready to be a part of those discussions in case that a moratorium is discussed or decided to move upon at the legislature level. We would like to be part of those discussions in case there's anything that the CRA feels that there may be some things that we would like to discuss to be involved with. On the retail prices, the orange line represents the top line and the blue line is the lower line. The blue line is the medical retail prices, and the orange line and the top line are the adult use prices. Again, this is average retail price per ounce. The industry may either use a per ounce or a per pound analogy. Either way, they can be converted, but what we use for our monthly reports that are available on our website is a per ounce price. And what's of here to note is when the adult use market took off, the price was over $500 an ounce, and where we are now is the adult use average retail price per ounce is $82. And so that is a rapid decrease from November of 2019 at the high of over $500 an ounce to now it's at its low of $82. What's of note here too in the graph is for the first time in October 22 was the retail average price per ounce of adult use cannabis was cheaper than medical. And that was the first time that those paths have intersected and adult use is now cheaper than medical marijuana product per retail price per ounce. As you can see also with this price here, that the decreasings occurred with both markets over time. Again, that is based off the feedback that we see of influx of more cannabis in the market and also the activities that we're hearing from the industry of possible illicit activities happening in retail, or in the regulated market. Okay, so this is the tax revenue of the sales, adult use excise tax and the medical taxes. the adult use sales are subject to a 10% excise tax. On the medical side, they're subject to a sales tax. Adult use has a sales tax as well. And so this is the breakdown of the total of monies that have been brought in for tax revenue from both industries over the past couple years. For the adult use side, the excise tax is actually broken down like this. 15% go to municipalities with retail stores. 15% go to counties with retail stores. 35% go to the school aid fund, and 35% go to the Michigan Transportation Fund. So all of these taxes are the end work of a lot of hard work from the industry, from the stakeholders, and from the consumers that prefer safe access to safe product. This is the tax breakdown of the revenues over the previous couple years. Okay, so these are some agency highlights. We have two main goals at the CRA right now, which is one, stay engaged with the stakeholders. And who are stakeholders? Licensees, associations, businesses, municipalities, as many people as we can talk to, legislature, anyone that we can have conversations with and stay engaged, figure out what's working, what's not in the cannabis environment. And the other goal is to increase our enforcement efforts on those that choose to cut corners in the regulated environment. And specifically, we've received feedback that there are those that are willing to cut corners and bring in illicit product into the regulated market to A, save costs and overhead, B, take advantage of that capability of receiving an economic edge against their competitors. But what that does is the end state is it puts the consumer at jeopardy, because where that comes into the production line, it may or not even be tested. And so from our perspective, we're trying to find that activity and hold those responsible that are doing that illicit activity in the regulated market. Again, that's the regulated market. On the illicit side, that's outside of the regulated market, we partner with our partners at Michigan State Police Marijuana and Tobacco Investigation Section. They handle the pure illicit side that's outside of the regulated space. And so stakeholder engagement, we have regular meetings with industry associations and consumer advocates. I really appreciate those conversations. That's where we learn. That's where we learn to figure out what can we change, implement, make things friendly for the businesses that are having right now. There's a time period in which our businesses are having financial issues with the collapse of the retail price per ounce. We have a scientific advisory work group where we engage with the scientific minds and figure out what's working, what's not in the testing world. And we have an additional slide coming in here with our fiscal year 24 budget request. Diversity, equity, inclusion working group, important to us. Our DEIW gives us great information and ideas of how we can improve social equity. For example, we received feedback from DEIW group and other advocates that we were charging social equity applicants an additional application fee if their application lapsed. And we realized we don't need to do that. Why are we doing that for social equity applicants? So we made that change in November that social equity applicants pay an application fee one time. That is a result of those conversations with our DEW group. Municipality summits, this is very important to us. Communicating with the municipalities. In the past, we talked to the same 10 municipalities a quarter. We felt it was time with technology, using Zoom, Microsoft Teams. Let's talk to as many as possible. Let's have outreach, and let's figure out what kind of questions municipalities have that we can answer for them. Are there municipalities thinking about opting in? Great opportunity to answer questions about licensing, enforcement, how we work, how we communicate. For key concepts, on the medical side, there are different application forms than the adult use side. It's important to educate the municipalities on some of those facets, and I think that's a great conversation piece and opening for outreach. So we had our very first one on January 30th. We're going to keep doing that every quarter. Successful. We had over 290 people, over 150 municipalities, give or take some of those numbers, but it was a very large gathering, and we want to keep increasing that outreach with the municipalities. Cannabis Regulators Association, we're a member of them. They're a national organization of regulators of cannabis across the United States. Again, we do not have federal guidance or support, obviously due to the Controlled Substance Act of where cannabis is or marijuana is right now. So we feel that it's important to reach out to regulators and talk about best practices. Legislative efforts, allowing for tribal commercial operations, modernizing regulation of industrial hemp processing. Those are some of the ideas that we are willing to talk about and be a part of in discussions. Administrative rules. This is another piece of talking to our stakeholders and listening. We had 11 different rule sets. 11. And our feedback that we were getting from licensees were it's very difficult to follow your rules that are in 11 different documents and how they all interact. We felt it was important to take all the information and combine it into one rule set. We did not make any rule set changes, but we put it into one document. A couple reasons. One, it's better for the licensees to have easier compliance to understand what our rules are, but also our staff, myself, I used one document. If you want to find your information, it's easier one document than 11. It's human nature. So we combine that from feedback, talking to our industry stakeholders. And what we're going to do is open up the marijuana rule set here in the near future, and use that one document approach. And again, that's from talking to our stakeholders. Enforcement. We are cracking down on illicit activities that are happening in the regulated market. We have been hearing, even for the first time in September in public meetings, that people are bringing in illicit materials from out of state, again, for an opportunity to get an edge on their competitors and purchasing things at a cheaper price level than it is to make it. We're trying to find that stuff, and we're trying to get those that are responsible out of the industry, obviously due process, but the desired end state is finding that activity and holding those responsible that are doing those. And again, we're prioritizing investigations into violations jeopardizing health and safety. And then our fiscal year 24 budget request, a recommendation, this is our big piece for us, is we'd like to have our own state-run reference lab. We'd like to be a leader in the cannabis realm in the United States, and those that have been around or elder to Michigan that have been regulating cannabis for a while have reference labs. We feel that it would enhance our investigative capabilities by enabling us to have a third-party independent marijuana laboratory. Right now, we do not have an independent third-party laboratory. We are using licensees to test products by other licensees. Now, this proposal is not asking for licensed laboratories to go away. We'll still regulate licensed laboratories. We're requesting a third-party lab. Think of it as a regulator or oversight of the licensed laboratories. What we think this can do is our goal is to increase confidence in the testing industry by performing audits, sampling audits, proficiency testing using this third-party lab. What we'd like to do is have a separate division of the agency that is compartmentalized and focused on the science and being that third-party laboratory. Total cost $4.4 million, $2.8 million one-time funding is the request, $1.6 million ongoing. We'd like to have this at our headquarters. We actually have space that's not occupied anymore after COVID. A lot of our staff work remotely, and we have space that's already built that is open that we think that we can turn into a laboratory. And for operations, $28 million, 173 full-time employees is what we're looking for. Right now, we are authorized 168. And this is for the regulating the medical marijuana, commercial and medical marijuana industries and industrial hemp processing. In the last slide, this is something that we feel very strongly about and feel very important. It's in our hearts here is the Cannabis Regulatory Agency wants to establish Michigan as the national model for regulatory program that stimulates business growth while preserving safe access to consumer access to product. Excuse me. Thank you. So that's the presentation, and thank you for your patience with the technical things in the beginning.
Well, thank you so much for that presentation. I'm trying to see how much time we've got. 7 minutes, and we've got a lot of questions, I'm sure. We can go till noon. I don't want to go till no. But have a couple quick questions.
Yeah.
You talked about the social equity programs. What type of outreach are you doing?
Sure. So specifically, we have regular meetings with our diversity, equity, inclusion working group, but also on top of that, we have a gold star, a silver star, and a bronze star program. And so we have that available on our website, and it's available for our licensees. For the bronze star program, what we do is in order to qualify, and this is something that we have a diversity, equity, inclusion working group, but also we have a social equity team designated with our agency. Without additional funding, this is something that we've instituted ourselves. And what we push out to the industry and let them know is that in order to qualify for bronze level at the All-Star program, licensees must publish their social equity plan on our website. To qualify for the silver program, licensees must meet the bronze level requirements and also publish their corporate spending plan on our website for everybody to see. And then we also have the gold tier program where licensees must meet the silver level requirements and then publish their community reinvestment plan on the CRA website. That's a piece of what we do. We also have the JVPP program, outreach programs, communicate with multiple different stakeholders and receive ideas and how we can figure out how we can move forward social equity. The reason we do that is in the MRTMA Act, the Adult Use Act, where our agency has to have a plan to promote and encourage participation in the marijuana industry by people from communities that have been disproportionately impacted by the marijuana prohibition and enforcement to positively impact those communities.
Thank you. The other one you really touched upon, and we've had a conversation about a lab to create a standard because there's too many variables in the market right now. So that would be a good thing. And in line with the equity, I look at 35% going to the school aid fund. Does that go into communities that opt out? If you know.
Yeah, so that money just goes directly to the school aid fund to be appropriated out of that fund. It's not a separate award. It just goes from the marijuana tax revenue into the school aid fund.
So one of the cities I represent has like 8, and then the ring cities have 0. But they benefit from the revenue. So with that, I will turn it over to, see a bunch of questions, a bunch of hands. Representative Nair.
Thank you, Chair. Hemp and marijuana are regulated under your department correct?
Mostly correct, yes. So we have a portion of hemp. MDARD has the growing side of hemp. We have the processor handler side of hemp.
So it's just a bit confusing how those got together because I understand they're same family, but it's a different product use altogether. So do you see a point at some time where that might be regulated underneath its own grouping as opposed to being regulated together with marijuana, the hemp industry?
Yeah, so I think those were, so MDARD used to regulate the processing side as well. It was just last year they were split up. And it's only because on the processing side, just the workflows of those businesses is very similar to what a marijuana processor goes through. And so we just have the personnel, the setup to handle the processing side of just the regulatory functions of doing that. Whereas MDARD, again, focusing more on agriculture, it's still set up more to focus on the grows. So just the difference in how the agricultural product versus the commercial manufactured product is regulated that makes it more suitable, I think, to just the strengths and the characteristics of our agency.
Okay. And then moving down to the lab that you'd like to set up, would that be your personnel that you're hiring yourself, or would you be contracting that out to a service?
There would be CRA staff. It would be a separate division. We would have a division director and then laboratory scientists and manager and then technicians that would assist with that. And that what we do want to do is compartmentalize our staff from other investigations, policy, not just in name, but also in policy.
Okay, thank you.
Representative McFall.
Thank you, Chair. You mentioned that there's discussions around a moratorium. Can you go into that a little bit more on some of the discussions that are being had about that?
Sure. So there are stakeholders, associations, licensees. There are many different flavors of moratorium. The majority of what we've been hearing is asking of legislature to amend MRTMA for the state to stop issuing grow licenses until a certain period of time. But also with social equity carve-outs. I'd say that's the majority of what we're hearing. There's different flavors of other license types that we've heard. What we've been doing is facilitating those discussions. And we'd love to be at the table to talk about any possible moratorium with the legislature because there are some things that the details would have to be worked out. When would it start? When would it stop? For example, we have an obligation in the law to make a licensing determination within 90 days. And if there is a moratorium and if there's an influx of applications before the moratorium, which has happened in other states, our agency would have a difficulty of processing 1,000% increase in applications in a 90-day time period if that happens. So I would just say that we would like to be part of those discussions if associations do keep approaching legislatures.
Thank you.
Thank you.
I'm going to go with Rep. Young because I'm sure Rep. Filler is going to do a cross-examination.
Thank you, Mr. Chair. Yeah, mine will be quick, so you're right.
All right.
So I was just curious about these under your executive budget recommendation and these 173 FTEs. What types of jobs are those? What type of background, what type of expertise do people need to access these jobs? Could you share a little bit about that?
Absolutely. So we have a wide array of different job types. So we have technicians, analysts. Some positions require a 4-year bachelor's degree or an equivalent of 5 years of a detective sergeant equivalency with the Michigan State Police, and those are more than investigators for some of those positions. But we have a plethora of different job types. We have legal analysts that help take in the workflow and lawyers that take in the workflow of our investigative efforts in the field. We have investigators, we have inspectors, which are 2 different job types. We have management staff, we have office assistants, we have so many different work opportunities with the CRA. And I appreciate the question because that gives us an opportunity for outreach of joining the CRA. It's a great organization. We have so many different job skills and diversity of people and what skills we need to implement and regulate the agency and the environment. And we have so many different job types. I appreciate that. I've never had this question before, so I'm excited to talk about it. Like, we have a great group of people, and we have so many different backgrounds, and we come together with one team, and we believe in this mission, and we really do want the best industry for our industry members in a consumer-safe product. And by doing that, we have great teamwork with who we have. So thank you for that question. I appreciate that.
How many employees do you have, if you know offhand?
Sure. So we're authorized 168. We're in flux approximately right now, about 164. There's some backfills of movements. We just promoted a few managers that were internal that we are holding other staff. We even have laboratory scientists on our staff as well. But we're authorized 168, and we just increased our field staff presence with the fiscal year 23 allotment in the budget. And that allows us to increase our presence and do unannounced inspections and focus our investigative efforts.
And before I get to Rep. Filler, I just, looking at that graph of the price going down, you go back to the old Econ 101 supply and demand. Is it too much supply and too little demand, or it's not a novelty anymore? Just if you know, if you don't.
Sure. This is a combination of feedback that we got from the industry and that what we also see data-wise and also boots on the ground talking to people. It's a combination of influx of product, so high supply, and also those that did illicit activities that drive the price down. It's a combination of both of those. Now, do I know the ratio between the two? I think it would be a great study in the future to figure out. But right now, the fact is we have more grows than we have retail, but it's also a combination of illicit activities. And we're doing our part to try to support those that are following the rules and get those that are not following the rules out of there so that we can help move the industry ahead.
Thank you for that. We do have one more, so after Rep. Filler, so Counselor.
I'll try to be succinct, Chair. Thank you. I do serve on the ALEC Cannabis Working Group, and the discussion there was really interesting that because we have a regulatory agency in Michigan, it drives investment and confidence in the supply. So I do believe in it, and thanks for your hard work on it. I guess my biggest question would be, what is the need to have medicinal licenses anymore? Why not unify the rec and marijuana? And we are going to follow up with you on that to get your thoughts, but I'm very interested in pursuing that.
Sure. On a basic level, we do believe that there is a need for medical patients to have access to their product. Now, whether or not there's a need for a medical license, for adult use license, is there a capability or opportunity to combine those acts? There can be, and I know there were talks of doing that in the past. We understand that it'll be a heavy lift. If you look at both acts, there's significant differences between the two. They were written from two different perspectives. I think that combining those acts just from a CRA perspective only, taking it out of the industry, it sure would be easier for our staff. And I think it would be easier for everybody when it comes to identification and understanding the rules, because we have nuances in our rules specific to one license type versus the other.
I mean, it's the same product.
Yes, there are different standards in testing, though, which is there to protect the health and safety of the medical patient. But beyond that, for the most part, I think there is an opportunity for discussions, and we'd like to be at the table along with the industry to talk about the heavy lift of combining those in the future.
Thank you. Thanks, Chair.
Thank you. We've got two more at it. Representative Grant.
Yes, my question is on the state-run reference laboratory. Are there other states that have a model that you may have seen that is succeeding? And along with that, have you seen any other states who have handled the balance of inventory with storefronts in a way that kind of will guide some of the things that you all are suggesting?
That's a really good question. So the first one's reference laboratory. California, Colorado, they have reference laboratories. The other CANRA states are either A, like us, have a proposal in for a laboratory. Right now, Missouri is trying to do the same thing, or considering or asking us what we used for our proposal, because they're thinking of doing that as well. What we're doing is we're communicating with CANRA. We have our lead scientist that's actually a part of the CANRA committee of laboratories and communicate on a regular basis to talk about best practices. So the things that we're picking that we think that it could work really well for us. Colorado is definitely one that we're looking at as well. But at the end of the day, our goal is to have a desired end state for standardized methods, but using the industry, bringing the industry along, having open discussions in CANRA as well. To get that desired end state. In the meantime, we want to do blind audits, proficiency testing. And again, it's going to help our investigation timeline. It's going to reduce our investigation timeline by more than 50% of illicit materials. Because right now, we have to rely on licensed labs to help us with investigations on other licensees. So it's working with other states in CANRA and modeling and being in discussions with them on that front. And then the other question, I would say that I'll give you an example. So Oregon is the first one that came across this same exact issue of influx of product and price crashing. And they enacted, my understanding is the first moratorium. And what we've been doing is studying their reports. And the data is still coming out. It's not conclusive yet, but there are some things that we've learned from that. For example, when they enacted their moratorium, they received 1,000% increase in applications in the last day that people could apply before the moratorium took place. That opened our eyes because that's going to be a lot of work on the back end for us, and that also potentially delays the effectiveness of those that want a moratorium in the future. From our perspective, it's continue to keep learning to figure out what is effective or not. But at the end of the day, from our position, our licensees and our stakeholders are our customers. If that's the direction that they feel they want to go in, we stand ready to be part of those discussions to figure out what we may need if we go in that direction.
Quick
Sure.
follow-up. I'm sorry.
Sure.
And then my question is, if at a certain point we are only allowing people to access a retail license for whatever short term that may be, does that affect their ability to create profit compared to their other counterparts who had more of an open market for both things? Does that raise the cost of what they can access as far as inventory? And I don't expect you to have an answer on that, but that is one of the things I think of as a repercussion of that.
Yeah, I think those are good questions. I think part of, again, is if there is a moratorium, what would it be? What would the restriction on license types be? And then what would be the secondary and tertiary effects of that? And I think those discussions we would love to be at the table with and talk to anybody along with stakeholders and associations. Because if we talk about the desired ask that those that want to do this, the devil's in the details. What is the secondary, tertiary effects of those two? So we'd like to be there too.
Thank you. Did you have any? Representative Wilson.
Thank you, Mr. Chairman. First, I just want to say I'm glad that you have not combine the medical and recreational yet. I think our caregivers and patients, our patients really care about how their caregivers are being able to cater to their needs. Like any medicine, one medicine does not fit everyone. So my question is, now that medical marijuana has been around over a decade now, have you heard consistent concerns or complaints from patients and caregivers, things that we need to be addressing?
I think a couple things that we addressed rapidly, and that was outreach and communication, was access. And the biggest concern that we were hearing is somebody would want a product and it would take so long for our agency to approve to be able to move it from one to the other from businesses. So that was a positive of us listening, and we felt that was a positive for patient access of now the businesses can do what any other normal business does, is move their inventory on their own and get the government. We have the ability to audit, but I think that was a big win for patient access. We continue to have regular consumer advocacy discussions. There are discussions that they have concerns about several things that are topics that we're thinking of for our next rule set. And so I think that staying in focus and communication with them is important too, because it's a holistic environment. We should be talking to the consumers and patients along with the licensees, associations, stakeholders, other businesses, state agencies. We're all in this together. And so I think communicating and keeping that dialogue with patients and caregivers is important.
I have one more question, Mr. Chairman.
Sure.
You talked about social equity earlier. Has there been any discussion around revisiting some of the licensing fee structure? As you know, it takes a lot of capital to get into this space, but I think it's shown that only probably 2% of the market is really even women minority owned. So how do you see the agency trying to assist in allowing more access for different populations to get involved in this industry? Any talks about the fee structure?
Keep communicating. Again, the fee structure right now, correct me if I'm wrong, is locked in for adult use. The medical one is open for potential modification in October.
Yeah, I think on the adult use side, real quick. So we have lowered it the last 2 times it came around, or at least the last one time it came around was to reduce it further. We were shocked to learn, and again, this doesn't necessarily address your concern. Other states will have license fees up close to $1 million for a license. And so, again, we've tried to maintain a license fee that is necessary to support our operations and not more than that. I think that's going to come up again when we open the rules. That's what the fees are established at. But I know there have also been discussions about providing some sort of direct investment for social equity applicants. Again, we've heard some of those conversations, but I know those are also ongoing out there amongst folks who have the same concern you do.
Okay.
And if I may, we're working internally on what kind of ideas that Derek just talked about of potential grant programs, ideas there. Here's another example of something we listened to is somebody would like to know what social equity licensees, where they are and where they can patronize their business and how to actually go there. And so we've been working with our attorneys and working internally to come up with forms to give people the ability to say that they're social equity licensees and put that on our map. And we've been working on that for several months. And that's an example of us listening to our DIW working group that gave us great ideas for that.
Oh, that's really good. Final question, if I can, Mr. Chairman. No. It could be.
We can certainly chat after if you'd like. We can do that.
Thank you all for being here today. Thank you for the information. I'm sure there's going to be a lot more dialogue as we work to try to figure this out, recreational moratoriums, testing. So we'll just continue to work with you and appreciate you.
Thank you.
With that, we need a motion to excuse absent members. Representative Filler moves to excuse absent members from today's committee meeting. With there being no further business before this committee, the committee will stand adjourned.